Thank you for joining us for the February 25th media availability with County Health Officer Dr. Ian Hoffman. From the Time Standard, the number of total doses administered is 26,789 on the county's dashboard, but the number of individuals fully and partially vaccinated only adds up to 19,415. Can you explain the discrepancy?
Sure. We've put on the dashboard the number of individuals who are either partially or fully vaccinated. So if you take the individuals who are fully vaccinated, they've received 2 doses. So you'd have to multiply that number by 2 and add the 2 numbers together. You'll come up with the full number.
From the Time Standard, does the county know if any residents of skilled nursing facilities still need to be vaccinated?
Yeah, the skilled nursing facilities have mostly gone through the first 2 rounds of the partnership, the CDC partnership. The 3rd round for many of them are coming up this week, so that will be their last visit. So there are some folks who are going to get their first shot in that last visit. And then we're working with the skilled nursing facilities and long-term care facilities for a long-term plan of continuing to vaccinate any new residents who come in and need to be vaccinated.
From the Time Standard, is the county making any safety recommendations for spectators at outdoor prep sports events now that team sports have been allowed to resume?
So spectators are not allowed at any events for youth or adults. What is allowed for the youth sports are age-appropriate supervision. So an adult or potentially multiple adults, depending on the situation and the age, who could be there obviously to supervise the youth, but also transport them, be there in case of an injury, something like that. So we're working closely with HCOE and Humboldt Del Norte League to, define what that age-appropriate supervision is, and also looking for clarification from CDPH for more specifics on that.
From the Time Standard, with athletes in high-contact sports required to be tested for COVID-19 weekly, is the county helping schools or H-DNL participants acquire testing kits? Which agencies are responsible for acquiring testing kits for high schools and their athletes?
So we've been working closely with HCOE for testing in the schools, and that testing can also be extended to athletes at those schools. There are also potentials for athletes to get tested through Optum site at Redwood Acres. They could go to their private physician. And there are 2 different types of tests that can be offered. There's the PCR test. We're also working with HCOE to implement antigen testing for schools and then potentially for athletes as well.
From the Time Standard, how long have HSU athletics and the county been planning for their return to competition? How did HSU and the county collaborate on developing the athletic department's return to participation process?
So collegiate athletics is governed by NCAA, and they have a set of regulations similar to the way CDPH has put forth regulations for youth and adult recreational sports. So HSU has reviewed those and submitted a plan to public health for our review, and we collaborated and discussed those, and so it's been a collaborative process.
From the Time Standard, is the county helping HSU obtain testing kits for its frequent testing requirements?
Yes, we are supporting HSU in their testing.
From the Time Standard, the dashboard currently states 3,151 is the total number of Humboldt County residents who have tested positive for the virus. Are there any residents who have contracted COVID-19 more than once?
We're not aware of anyone who's contracted COVID more than once in Humboldt County. There are very rare cases of this across the globe. There are a few people who've tested positive twice within a 90-day period, but didn't have a reinfection, and those are removed from the count.
From reporter Daniel Mintz, how likely do you think it is that the variant with the L452R mutation will be categorized as a variant of concern?
I think more studies needed to determine that, and so currently it remains as a variant of interest.
From reporter Daniel Mintz, what is the scale of testing at this point?
We definitely know testing's down. both here in Humboldt County and statewide. We have the capacity to test much, much more. So continue to encourage people to get tested and utilize that testing ability so that we can, stay safe and hopefully continue to stay in less restrictive tiers.
From the Redwood News. You've mentioned before that the next group eligible for a COVID-19 vaccine includes food and agriculture workers. Can you go into detail about who exactly falls into this category locally? Does this include grocery store workers, restaurant workers? Also, are you able to give the community any update on when that phase is expected to open up?
So yes, all those people mentioned fall into the food and agriculture workers. It also includes the production side, so people who produce food, both in a farm or in a warehouse, large scale kitchens. It's a huge, runs the gamut. I think that just like every phase that we've opened and how we open it will depend entirely on the amount of vaccine that we have. So we're hopeful that with Johnson & Johnson coming in the coming weeks, that we could see an expansion of the number of vaccines that we're getting each week. We also know that the federal government has continued to promise to send more. It looks like that is actually starting to happen in the next few weeks. So when we have enough vaccine, we'll open up to more tiers.
From the Redwood News. The state has released guidance about opening up vaccine eligibility to people 16 to 64 years old with certain medical conditions starting March 15th. How exactly will this guidance be implemented locally? Does the county have enough supply or anticipate having enough supply to open up vaccinations to this larger group of people starting on that date?
I think it's unlikely that we will have enough to cover everyone by the middle of March. So it'll be, how it's continued to be, which is when we open up to one group, we, understand that there will be a waiting period for some of those people. But as it's been the whole time, we have to, sort of time these openings so that we don't have too small of an eligibility pool that we have vaccine appointments that go unfilled, and balance that with, keeping the field broad enough that those people can get, narrow enough that those people can get an appointment. As far as how it's going to work, we have been in discussions with the medical groups around Humboldt County, and for people who have medical conditions, it's most likely that we'll be working with medical providers to have them call those patients in based on their medical records, and doing outreach, and then have some sort of referral system to allow for people who don't have access to a vaccination site through their primary care provider, or who don't have insurance or don't have a primary care provider here in Humboldt County to be able to be referred to a vaccination site.
From the Redwood News. CDPH has indicated they'll be shifting to an age-based vaccination plan after Phase 1B Tier 1. What does this shift or change mean for Humboldt County's vaccination plan moving forward? Are there or will there be any impacts on Phase 1B that is currently open?
There shouldn't be any impacts on Phase 1B. We're going to continue to finish that off. In terms of what the shift means, it really means that after that, those occupations in Phase 1B, that everyone will be going through the line based on their age, and those will open up, we're being told statewide, all at the same time. So that's what we anticipate and we'll be looking forward to.
From the North Coast News. A viewer messaged us recently concerned about canceled vaccine clinics due to vaccine shipments delayed by inclement weather. Have all the people scheduled for those clinics been contacted to register for another clinic? Has anyone missed their second dose of the vaccine due to those cancellations?
So public health has reached out to everyone who had their public health clinics canceled due to this delay. We do recognize that some people were delayed in getting that second dose on time, but it should still fall within the realm of acceptable based on the CDC guidelines.
From the North Coast News. Where does the county currently stand on allowing organized youth and adult sports? Will the county be following the guidance issued by the CDPH, or will you be setting more strict requirements?
We are following the CDPH guidance that was set out last Friday and goes into effect tomorrow. And we think that it's really solid guidance, and look forward to seeing youth and adult sports getting back into action.
From the North Coast News, where is the county currently at in terms of vaccinating the local homeless population? What outreach, if any, has the county employed to contact elderly members of the homeless population who may not be aware of their eligibility status?
We've been in planning meetings with homeless advocacy organizations to address these communities. We have plans in place to begin vaccination of age-appropriate individuals in that population, and also working to try to vaccinate more broadly in the homeless population once vaccine becomes more available.
From the North Coast News, has public health considered prioritizing vulnerable populations more at risk for contracting the virus, like those experiencing homelessness and incarcerated people? Or will people in those groups have to wait until their age group is prioritized?
Incarcerated individuals are those who are in prison are handled by the State Department of Corrections and Rehabilitation. The staff who work in our local jails have been vaccinated. We have been in talks with the jails about a potential vaccination plan for that population. I think this group is definitely vulnerable, and we recognize that, and we want to vaccinate them. We are just waiting for more vaccine to make that happen.
From the Lost Coast Outpost. By this point, many or most people in Humboldt have heard several first-hand stories of friends and neighbors getting the vaccine through unofficial channels. For example, by showing up and waiting in line at a clinic or hospital, or by being put on a wait list for extra doses through friends who work at such places. Many people acquiring the vaccine in this way are not over 70 or over 65, and they're not employed in healthcare or education or emergency services. This happens often enough that some people believe that there are loopholes in the county's guidelines, and that if you can put in time and effort, or if you know someone, you can get vaccinated now, even if your tier is not up. Can you convince them that this is not the case?
We are in the business of getting people vaccinated, and so we are trying to do that in an orderly fashion and as quickly and seamlessly as possible, with the focus on the right populations at the right time. Certainly, some individuals are going to extreme measures to get vaccinated out of order. We've said often we're not going to try to police that to a degree that slows down this process. We encourage individuals and groups of individuals to follow this process, and I think it'll go much more smoothly. And we hope to be able to open up more broadly to other groups in the near future, and we'll continue to do so as vaccine allows.
From the Red-Headed Black Belt. Earlier this month, Humboldt County announced that they would begin reporting the number of antigen test results each weekday on the dashboard. The number reported has remained at 13 for some time now. Are antigen tests not being used, or are there no positives, or is the dashboard not being updated?
The dashboard continues to get updated on a daily basis. For a while, there have not been any positive antigen tests, which is not surprising given the drop in the test positivity rate. I do think they're still being used. I know they're being used in many settings. So we'll continue to watch that, and I think going forward, the other thing is they might be used more often, say in schools or other surveillance settings that with the sports leagues that are starting up. So we might see that go up, but again, it's because of the decrease in test positivity overall that we're seeing that number go down.
Thank you, Dr. Hoffman.
Thank you.